Welcome to Behind the Headlines. Postpartum depression affects 1 in 5 women after childbirth, and yet services to support new mothers' mental health is very scarce. I'd like to welcome Dr. Nirmaljit Dhami, Medical Director of El Camino Hospital's Maternal Outreach Mood Services, to Behind the Headlines to talk about this issue. So thank you for being here today. How is postpartum mood disorder different than the baby blues?
So thank you for having me. Baby blues is a more common condition. About 80 to 85% women struggle with it, and it often presents with mild symptoms of anxiety and tearfulness, and usually resolves on its own within a few days. Whereas postpartum mood disorders that comprise of depression, anxiety, bipolar disorder, psychosis, and OCD are far more severe in range and intensity of symptoms, and usually do not resolve on their own and cause significant impairment in functioning of the mother.
And what causes postpartum mood disorders? I know that it doesn't, just because if you have a pre-existing mental illness or if it runs in your family, that doesn't mean that that'll happen to you after giving birth. And conversely, if you've never experienced mental illness before, you can also contract postpartum mood disorders.
So that's, again, a great question. The cause, we can't really name one cause for it. There are many causes, and the way to look at it is a biological psychosocial model. So there are biological factors like having a prior history of depression, having a prior history of bipolar illness, prior history of psychosis. There are social factors like lack of social support, stress at work, sleep deprivation is a big factor, family support, family history of mental health issues. These are people that are related to the patient by blood. They're all predisposing factors. And then the other really big factor is the hormonal changes that the body and the brain experience during pregnancy and childbirth.
Now, I understand that the El Camino program is one of the few in the country that deals with mothers that are suffering from this postpartum mood disorder. Why aren't there more services available?
That's a great question. I think it's unfortunate, and in my opinion, more services are not available because of lack of awareness and just an inherent reluctance in the medical field to screen for these disorders. Because if you think about it, women that struggle with mental health disorders in pregnancy and postpartum are seen mostly by OBGYNs and then by pediatricians. And so there is a significant amount of reluctance to screen women for perinatal mood disorders because there aren't very many resources to refer them to. So there is the lack of screening, lack of treatment, and then lack of community support. And I think all these factors come together for the care to be this inadequate.
You and I have also talked a little bit about how the difference between healthcare systems in the United States versus in Europe, where there are many, mother-baby inpatient psychiatric units and just more services of this kind. Why is it that the American healthcare system is, this is a loaded question, but why are those two systems different and the services are still rare here?
That question has many, many layers to it. I think they're different at a policy level. I think they're different at the public health, public outreach level. But I think the core difference is in terms of how we think about maternal mental health. And in Europe, the thought is that the mother and the baby should not be separated during mother's mental health treatment. Whereas in the United States, we look at the mother more as an individual and focus just on her mental health issues. We don't, in my opinion, I don't think very many insurances or payers will cover a joint admission of a mother and a baby. So we don't have the traditional mother-baby units that have been in Europe since, I believe, since 1980s. because of that reason. And that's a significant gap in maternal mental health care for the United States.
And could you talk about the impact of separating a mother and a newborn baby in this way? There was a mother in the story who ended up in a psychiatric ward because that was where her family knew to take her when she was in the midst of postpartum psychosis, and they really had to fight to get visits from the newborn baby because the psych ward was just not at all set up to do that, and the family felt really strongly about having them see each other during this really pivotal moment of each of their lives.
Yes, I think that, again, there's a lot of data, most of it out of Europe, in terms of the deep and prolonged impact that separation from the mother can have on a baby. I think this is a bi-directional relationship. Separating the mother from the baby really takes her away from the environment that she then has to go back to take care of the baby. And so her healing and her recovery that happens in a psych ward when the baby is not there is really is almost in a silo, and it doesn't preserve the environment that needs to be preserved. And babies that are separated early on from their mothers go on to have more anxiety disorders, more difficulties regulating their mood and emotion. I also think, and I've heard a lot of stories from my patients of the very traumatic experiences that they have in the emergency rooms when they present with agitation or mood issues. And usually this is the first time a lot of these patients have had any mental health contact, and for them to be placed in 4-point restraints and be injected forcibly with meds is really traumatic. I've had patients who tell me that their breasts are leaking, they can't find a breast pump on the unit, they are asking for basic things like water, and at times they don't get that. And I think that intervention with supportive family and explaining to the patients what they're experiencing and recommending meds and just talking more to them would be far more helpful than the process that we have for emergency admissions.
Yeah, and I know the fear of going to an emergency room or even to a doctor and admitting that you're having scary thoughts about harming yourself or harming your baby if it's at that point, or just even admitting that you're struggling that intensely. A lot of mothers I spoke to just said, it was rational, but I worried that my baby would be taken away from me, and I had no idea what the consequences would be of opening up, so they chose not to seek help.
Yes, about 40% of women that experience postpartum depression and anxiety have what are called intrusive thoughts, and these are scary thoughts of harm coming to either their baby or themselves. And they come out of the blue, they're terrifying. Patients often take a lot of protective measures to not act on these thoughts, and they don't have any intent of acting on these thoughts. They are terrified and tormented by these thoughts, but there is fear that if they go and tell this to a clinician, some 911 may be called, they may be put in handcuffs and taken to the emergency room, or Child Protective Services would be called on them just for admitting that they've had these very difficult, traumatizing thoughts. And we in our moms program have had some moms that have been referred to us and have told us that when they reached out to their primary care providers with these thoughts, they were reported to CPS, and CPS got involved in their care, which was often more anxiety provoking for them. And intrusive thoughts are not that difficult to treat if the clinician understands what they are and works with the patient.
Yeah.
And I think in reading your story, it seemed like most of these moms didn't even know that this was an actual disorder that existed, so they didn't even realize that they might have something clinical going on, right?
I think there are a lot of misperceptions about postpartum mood disorders. A lot of moms I spoke with just said, my understanding of it was sort of those horrible headlines you hear about the women who do hurt themselves or their babies, which are the extreme rare cases. Or it's just they felt like, now looking back, I can recognize it, but when you're in it, like so many, when you're struggling emotionally, it's very hard to recognize when you're in it and that you need help. And especially when you just had a new baby and you're told to expect that you're going to be exhausted and overwhelmed and irritable. And so the lines feel kind of subtle, I think, when you're in the midst of it.
Yes, and this is where the role of a supportive family, a supportive partner, and having a really astute and informed physician comes in. Because a lot of our moms see their OBGYNs for regular prenatal visits, and there is a lot of depression and anxiety that starts in pregnancy. And simple screening tools like Edinburgh postnatal depression scale can screen for a lot of these conditions. And it just takes like 2 or 3 minutes to do it. So I think that's a gap we all have to bridge.
Why don't you tell me a little bit about the program offered at El Camino that you had up? Tell me how it works.
Okay. So our program started about 10 years, well, a little more than 10 years ago. And we had a patient who had come to us for help about 12 some years ago and was postpartum. And there was no program that was geared specifically for postpartum patients at that time at El Camino or anywhere in the community. And my understanding is that this patient had a really bad outcome, and that generated, as you were mentioning, a lot of news. And then the community came up with a recommendation that we were lacking a program that met the needs of pregnant and postpartum moms. And then El Camino Hospital and its medical staff and the administration supported the creation of our program, and it was created with the help of a grant from our foundation. And we started with 2 patients. We currently have, right now we have 8 patients. Our average census is about 10 to 12 patients. So we are a 4-day-a-week intensive outpatient program in which women who are pregnant and postpartum and struggling with any form of mental health issues in pregnancy and postpartum are treated. I think of it as we treat the woman and her baby, and then we treat the woman, baby, and partner. So we have multiple stages of treatment. It's not just addressing the mom's mental health, but it's really taking the needs of the family into consideration and working on issues that come up within the entire family unit. We have therapists, have a nurse, and occupational therapists. There are lots of groups for patients and groups on that focus on their individual issues and then on mother-baby attachment. And there is a group for families too. And as patients begin to do better, we move them to a schedule that's not as filled up, and they have days when they can do their own activities with their babies. And then when they are ready for discharge, we have a graduation for them. And a lot of our patients come back and let us know how well they're doing. Sometimes they come back with subsequent pregnancies if they have a reoccurrence of their mood symptoms. And for our pregnant patients, we come up with a birth plan and we communicate that with the OBGYN. And then our staff stays in phone touch with them as they go through the process of delivery and support them through it. And then we check in with them on how they're doing. And then if they want to come back, they're welcome to come back.
So Camino track any data on sort of the impact of the program for moms?
We track it informally in terms of satisfaction scores, patient satisfaction scores with the program, with the treatment. But we have not, to my knowledge, I don't think we have long-term data.
Is that of interest to El Camino? I mean,
yes, I think data to show at least improvement in terms of functionality and improvement in terms of well-being. I think that would be an important indicator. More so now if we want to encourage other hospitals and communities to develop these programs.
Is there any sort of awareness campaign that goes along with it where you're educating the doctors so they know what to look for when pregnant women come in, or is there anything like that in place now?
Yes, so we recently had a mental health symposium at El Camino to celebrate the 10 years of moms, and we invited a lot of people from the community to come and learn more about perinatal mood disorders. I do grand rounds on a regular basis at El Camino, and then our staff, our lead therapist, does outreach with the local OBGYN offices and gives out information. So we try to do educational outreach within our community.
I
But,
also spoke with, sorry, go ahead.
but more needs to be done.
Yes.
And just one quick question, insurance covers the program through El Camino, is that something?
The insurances that the hospital takes are covered through the program.
I was just going to say, I spoke with the head of the women's wellness clinic at Stanford, and she said that they're doing a lot to try to train, psychiatry residents and then also pediatricians and OBGYNs to sort of increase that awareness, because she and the pediatrician I spoke to described as sort of being aware of it, but not having the training to know how to address it really, or where, like you said, to where to point them, or to point mothers to if they do realize that something is sort of off or not okay.
Yeah. We do get a lot of referrals from Stanford Women's Wellness, and we get some referrals from local pediatricians. We don't get as many from OBGYNs, and I think that's an educational change that we have to continue to work at.
And how did you get involved with the program at El Camino?
So I had started working at El Camino about 11 years ago, and then it was interesting. The doctor that was supposed to do this program went on maternity leave, and so my boss asked me to do it. It was a new field for me, and I just thought I would try and see how it goes. But it was a new experience and a little bit anxiety-provoking. And I was very early on, I realized that there was not much in the United States in terms of treating these patients. So I joined an organization called Marseille Society, which is an international organization of OBGYNs, nurses, psychologists, social workers, and psychiatrists who all work with pregnant women. And a lot of our work they gave me a lot of support in terms of clinical work and just sharing their knowledge, their skills, and their experiences, and that really helped our program and me in the process. And we're getting a lot of collaboration from them now too as we move forward to create our inpatient moms unit. So we're collaborating with the University of South London and then with UNC in North Carolina, and they are really, kind of the pillars that are helping us build our new program.
I'm curious, over the last 10 years, how you've seen the stigma related to maternal mental health shift or not shift?
What I've seen is that there is a wider recognition of postpartum depression, and I think that is related to the educational outreach and the policy changes that are happening. What I have not seen is kind of a willingness to screen regularly. So I think that has to shift. I have not seen much education about postpartum psychosis, postpartum bipolar disorders, or bipolar disorders in pregnancy, OCD. I have not seen much shift in that, but I've definitely seen a wider recognition of postpartum depression.
When you screen, do you just ask someone questions, or how do you screen for something like this?
So yes, I think you ask the patient how they're doing. You give them a screening tool. They can answer questions in terms of, are they able to feel joy in their life? Are they able to function, take a shower? Are they able to feel a connection with their baby? And then we talk with patients about thoughts of self-harm, intrusive thoughts, how their sleep is, do they feel supported, and then of course also screen for bipolar symptoms like agitation, irritability, racing thoughts, screen for obsessive compulsive behaviors, and then we also screen for postpartum psychosis, which often presents with a lot of confusion and disorganized thinking. A big part of the screening is involving their partner or whoever's helping them in the process and talking to them, because they can often give a lot more information. So yeah, these are broad questions about their functioning and their mental health.
Before we started the show, you were talking about how most of your referrals come from word of mouth, sort of within the mothers community. And in the story, you can tell these women just feel so compelled to talk about what they went through, even though, during it they couldn't even imagine sharing any of it publicly, but feel very compelled to let other women know that they're not alone and that there is help and that, this is treatable as long as you get help soon. Could you talk a little bit about just sort of seeing women come back to talk about the program or sort of their advocacy after they've gone through it?
Yes, it's really, it really impresses me and humbles me to see how much our patients are willing to give back and open up about their very difficult journey. And I think it's the nature of being a mom. You want to take care of people, you want to take care of children, you want to take care of others. But I've seen this more so in the moms community than I've seen in other, working in other programs like the geriatric program or the straight partial program. So we've had a lot of our own patients who've gone out and done advocacy because they strongly feel that this is an unmet need, and because they have done so much well and have had such a good outcome, they want to do more to give back. And I also know of some cases, not our patient, but I know of some cases where the outcomes were not as favorable, but the families and the spouses want to do outreach because they want to change things and not let what happened to them happen to others.
Is there anything else that we didn't ask you that you wanted to add?
Well, I just want to, this is more a message for the providers, the OBGYNs and the pediatricians, that, if you don't ask the question and a patient is suicidal, their suicidality is not going to go away just because you didn't ask the question. But if you do ask it, you can refer them for help. That's all that I can say.
And we have, there's some resources in the story and online for if women who don't know where to go, including El Camino Hospital and some other local resources in the area.
Okay, well, thanks for joining us. That wraps up today's Behind the Headlines. If you want to stay up to date on Palo Alto news, go to paloaltoonline.com or follow us on social media. We're taking a break from filming next week, so have a happy Thanksgiving, and we will see you in 2 weeks. Thanks.